Today, we're going to break down a condition with one of the most peculiar symptoms I've ever heard of, Frey's syndrome. It sounds almost made up, but believe me, it is a very real and very strange neurological puzzle.
No, really, just try to picture that for a second. You're not hot, you're not exercising, you're not even nervous. You're just thinking about dinner, maybe craving a burger, and bam, one side of your face starts sweating. That is the bizarre reality for people with Frey syndrome. So what on earth is going on here?
Well, at the very heart of Frey syndrome is the symptom called gustatory sweating. Now, gustatory is just a fancy word that means anything related to taste. So let's break down exactly what this means. Okay, so here's the official definition. We're talking about a rare neurological condition that causes you to sweat and flush on your face. And the trigger? Literally anything that makes you salivate. Eating, talking about food, or yeah, even just thinking about something delicious. It's not just a little glow either, it can be some pretty intense sweating, usually around the cheek or temple area. Now, while Frey's syndrome itself is considered rare in the general population, it's actually surprisingly common for one very specific group of people. Get this, somewhere between 30 and 50% of people who have surgery on their parotid gland, that's our body's biggest salivary gland, end up developing these symptoms. And that right there is our single biggest clue to what's causing it. So here's the crucial thing to understand. This isn't a problem with the sweat glands themselves. Nope, this is a communication breakdown. It's a classic, literal case of getting your wires crossed. To get this, you gotta know about two different nerve systems that are normally doing their own thing. First, you've got your parasympathetic nerves. Their job is to tell your salivary glands, hey, time to eat, make some saliva. Pretty straightforward. Then you have your sympathetic nerves. They're in charge of your sweat glands, telling them, all right, let's cool the body down. Two totally separate jobs. They don't usually interact. But here's where it all goes wrong. Remember that parotid gland surgery we just talked about? Well, that gland sits right in front of your ear, and wouldn't you know it, both types of these delicate nerves run right through that area and can get damaged during the procedure. And now for the really wild part. As your body tries to heal itself, those damaged parasympathetic nerves, the ones meant for making saliva, they start to regrow. But they get lost. They make a wrong turn and end up connecting to the sweat glands in your skin instead of the salivary glands that we're supposed to be heading for. So you can see what happens next, right? Your brain sends out that totally normal signal, time to eat, make saliva, but because of the rewiring, that message gets delivered to the wrong address. The sweat glands get the signal, and they just do what they're told. They start producing sweat. It's a complete, and you can imagine, sometimes very awkward biological mix-up. With a symptom this bizarre, you're probably wondering, how in the world do doctors actually confirm that this is Frey's syndrome and not something else? Well, it turns out they have this surprisingly low-tech and incredibly clever test. It's called the minor starch iodine test. Here's how it works. First, the doctor paints some iodine on the patient's skin where the sweating happens. Once that's dry, they dust it with plain old cornstarch. Then, they give the patient something really sour, like a lemon, to kickstart that make saliva signal. And if they have Frey's, they'll start to sweat. When that sweat hits the iodine and cornstarch, it causes a chemical reaction that turns the whole area a dark blue or brown. It's simple, it's visual, and it's a slam-dunk diagnosis. Okay, so you've got the diagnosis. What can you actually do about it? Since there's no way to just uncross those wires, all the treatments are really about managing the symptoms. For a lot of people, the most effective solution is, believe it or not, Botox injections. That's right, the botulinum toxin temporarily blocks those sweat glands from getting the misdirected nerve signal. The effect usually lasts for a good 9 to 12 months. Other options include special creams or even just strong antiperspirants, but you usually have to apply them pretty frequently to get any relief. And what about surgery to actually fix the problem? Well, that's pretty rare. As this review points out, it's really considered a last resort. It's only for those cases where other treatments just aren't working, the symptoms are truly debilitating, or for other complicated medical reasons. Which, of course, brings us to the big idea. If this whole thing starts with that first surgery, can we just stop it before it even begins? And the answer is, yeah, surgeons have come up with some pretty clever ways to try. The basic idea here is simple. You put up a roadblock. During that initial surgery on the parotid gland, the surgeon can insert a kind of physical barrier. It could be a layer of tissue or a special medical material right between the nerve endings and the skin. The whole point is to block those damaged saliva nerves from growing the wrong way and hooking up with the sweat glands. But this is where things get really interesting. A big analysis of all the different techniques found something fascinating. When doctors use that objective starch iodine test to measure results, a material called an acellular dermal matrix works best. But, and this is a big but, when you just ask patients how they feel and what their symptoms are like, a graft of their own tissue, called a temporal parietal fascia, actually comes out on top. So there's still a real debate about which method is truly the best.
And that all leaves us with one final fascinating question that doctors are still working on. Are these surgical barriers actually stopping the nerves from rewiring incorrectly for good? Or are they just slowing the whole process down, just delaying the inevitable? The amazing and still pretty mysterious ability of our nerves to regrow means this story isn't quite over yet.